Right. So having an essay on nosocomial or hospital-acquired infections. Nosocomial or hospital-acquired infections. So they just asked you to write an essay on nosocomial or hospital-acquired infection. So I asked you to write on something like this. You always give an outline so that the staff will actually know what they are expecting. You understand? So we'll go on talking about the definition. We'll talk about the epidemiology. We'll talk about the risk factors. We'll talk about the consequences, sources of infections, pathogens involved, sites commonly affected, examples of hospital-acquired infections, infection prevention and control measures, okay, to reduce all these hospital-acquired infections. So it can just be defined as what? Infection acquired in the hospital by a patient. So a patient came to be treated for a different thing. So while in the hospital, he also acquired another infection. So the patient was admitted for a reason other than that infection that he got from the hospital. You get? So in whom the infection was not present or incubating at the time of admission. So he got this infection and it is what? Completely was not there where you were actually coming to the hospital. So symptoms usually appear at 48 hours after they have admitted you. So these include infections acquired in the hospital which appear after discharge too. Also occupational infection amongst like the staffs of the hospital. You know, as a staff, you actually you are the risks of actually going into these infections. You get. So WHO definition. Now hospital-acquired infection is an infection occurring in a patient during the period of care in a hospital or other healthcare facility. So this infection was not there. Okay, it was not there at the time that this patient was actually admitted. So categories include infection contracted or developing within 48 hours or more after the patient was hospitalized, infections contracted but not becoming clinically apparent until after discharge. So up to 30 days after the discharge or within 1 year if the patient actually had an implant. Maybe they did one transplantation for you. That one, the time that they usually give it to call an infection hospital acquired is usually longer. Okay, that one is after 1 year. So if also infections contracted by hospital staff as a consequence of their occupation. Of course, you are dealing with a lot of patients and you might actually just you might actually like what did he call it? Get an infection, you understand? So epidemiology now. It's 5 to 10% in developed countries, 10 to 30% in developing countries. So rates vary between countries, within the country, within districts, and within even the hospital itself. And this is due to what? Complex mixture of patients, aggressive treatment, local practices. Risk factors is if you have an impaired natural resistance to infection, so you are immunocompromised, right? If you have a pre-existing disease like diabetes or immunodeficiency status, immunosuppressive therapy like cytotoxic drugs, you are taking some medication that are basically what's keeping your immune system on the low side. So bypass of defense mechanism like catheters or surgeries, also antibiotic treatments. All of these could be factors. So what's the consequence? If you have stayed in the hospital for a very long time, okay, additional morbidity like you have some other underlying disease condition, okay. Consequence of hospital-acquired infection. It has led to what? People staying longer in the hospital. That's like the consequence of it. It has led to additional morbidity. It has led to increased death of patients. So sometimes a patient might go to the hospital for a different reason, and might end up dying for a different reason. Okay, there's also long-term physical and neurological consequences. It has caused direct patient cost increase. Okay, sources of pathogens, it could be endogenous, could be exogenous. Okay, endogenous is normal commensals on the skin, the gastrointestinal tract, genitourinary tract, respiratory tract. So for different reasons, they might just grow more than usual in the hospital environment. Exogenous could be inanimate environment, like you got it from maybe touching some one or two things in the hospital. IV fluid, air, dust, catheter, wash bowl. The animate in environment is cross infection, so patient to patient, or patient to medical personnel, or medical personnel to patients, or visitors to patients, or visitors to medical personnel, or the other way around. It's different. Okay, factors now. If you are susceptible, it also depends on the organism causing it. Also depends on the route at which the organism actually got into you. Okay, so these are basically the gram-positive bacteria that are implicated in hospital-acquired infections, then gram-negative ones that are implicated in hospital-acquired infections. Staphylococcus epidermidis, streptococci, enterococci, Clostridioides difficile, and the rest of them. Okay, so we have examples of fungi there. This one was bacteria. Okay, this is fungi, Candida species, Aspergillus species, mucor. Right. So sometimes these fungi, they're usually growing because there's now increased use of antibiotics. So the antibiotics usually kill the good bacteria in the body. The good bacteria in the body, sometimes they prevent these fungi from growing. Okay, could be viruses like HIV infections, hepatitis B and C, cytomegalovirus, herpes simplex, viral influenza, parainfluenza, rotavirus. Okay, protozoa infections like entamoeba histolita, Giardia lamblia, Plasmodium species. Transmission, it can be contact, could be airborne, could be common vehicle like food and water, contaminated blood or blood product, tissue contamination, arthropod borne. Okay, so sites commonly infected is urinary tract. Okay, when somebody's using catheters, surgical wounds, respiratory tract, skins, blood, gastrointestinal tract, cardiovascular system. So examples of hospital-acquired infection is urinary tract infections, catheter-associated, hospital-acquired pneumonia, surgical site infections, nosocomial bloodstream infections, then gastroenteritis. Okay. So prevention and control is clean hand hygiene, cleansing, disinfection, sterilization. All those are septic techniques, right? Skin decontamination, safe disposal of hospital waste, protective clothing, prophylactic antibiotics, isolation. Hospital building and design should be what? Unique, in which all those waste products are easily disposed, personal welfare, and surveillance.